The project that we're discussing today is a project called VIP Smiles. It's really the first attempt within the UK to have a brand for UK dentistry, which seems a little bit strange that in this day and age when everything is so brand driven, that something as high profile as dentistry really doesn't have a brand. I'm a dentist, qualified 92, came out of university, did a stint in general practice, and then went on to do a little bit of oral surgery, and then came back into general practice, or more specialised practice, after being involved in a car accident. So I was out of dentistry for a bit. During that time, I managed to get into the more corporate side of dentistry, and had an understanding of how that aspect of the business side of dentistry works. So I came back into practice, decided that we were going to set up a practice that was more advanced, looking at some of the leading techniques and some of the developments that were happening in the world, and try to bring that to Edinburgh. Certainly we find that here, certainly in Scotland, that a lot of the things, a lot of the technologies, we lag behind quite a bit. So it was very interesting in developing some of these new concepts and some of these new ideas in dentistry. Well, VIP Smiles is a very exciting project. It's been something that we've been part of now for the best part of eight to 9 months. Lucky to have been working with some of the leading dentists in the country. We have a lot of patients who travel to us from sometimes quite some distance to get to us. They've read about an article, or they've seen us on TV, or so they've sometimes travelled quite a distance to see us. And when I ask these patients, why us? They can give me a whole range of answers, and I'm thinking, actually, there's so and so within 2 miles of your house. They could probably provide exactly the same treatment. Save you having travelled the best part of 200-300 miles to come and see me. So it really was an idea to bring together those practices, initially anyway, the practices that can deliver a very high standard of dentistry, are recognised amongst the peer group as being some of the best in the country, dentists who lecture here and internationally, so have that grounding, give patients reassurance that when they go to a place that's VIP Smiles approved, they are getting the very best of dentistry, but it's accessibility as well, letting them know that these practices do exist. We're working with practices that are already busy, successful, some of the leading practices in the country. We're then going to have a brand that associates those practices together. The practices will still be what they are, but by carrying the VIP Smiles banner, patients can have the reassurance that it's been accredited to a certain standard. There's transparency of cost, there's standardizations of costs, there's accessibility to a range of treatments that we feel are leading, cutting edge treatments, and being provided by dentists that are at the head of their profession. We're looking to do with dentistry exactly what Specsavers have done for opticians. It seems crazy in this day and age of such brand awareness and brand driven products that dentistry doesn't have any specific brand that most people can think of as a dental brand. We're looking to raise £300,000. The details of that in the business plan, but to give you a very rough outline, this is about branding. It's about developing a brand that patients can warm to, can understand, can relate to, can trust. We're now working with some very, very leading companies to develop that, to develop those concepts, and to have a very, very good online social media campaign supported by an offline one as well. There's been a lot of interest from dentists who are keen to get involved, a lot of interest from manufacturers, from suppliers who are very keen to see this kind of thing work. Organisations are sort of gravitating towards this. We've been approached by many, many dentists who want to be involved, many businesses who want to be involved, many corporates who want to be involved, a lot of strategic partnerships waiting to be developed here. Over the last few years, there's certainly been lots of confusion in the market, confusion certainly amongst dentists even themselves, in how to go about representing their brand and their profession, and that's also been confusion amongst patients. Where do they go? Who do they go? Are they getting the right treatment? Is it at the right cost? This is long overdue. There's been a lot of excitement. I've been fortunate to be involved in several startups over the years, and this is by far the most exciting project that I've had the privilege to be involved with. Well, we're very fortunate to be working with some of the leading figures within dentistry. The two clinical directors I have on board are very renowned within the UK. Firstly, one of my clinical directors, Dr. David Bloom. David Bloom was the president of the British Academy of Cosmetic Dentistry, lectures extensively in the UK and is one of the leading practices in Watford, Sonova Dental. My other colleague who's come on board is Dr. David Winkler. David internationally is, I don't think there's a more connected person and well-respected person in the world of dentistry. Internationally, so many papers to his credit, so many international lectures, very well respected in the development of dentistry. So clinically, we have a very, very good team on board. Over and above that, from the business side, I'm very fortunate enough to find a few years ago Craig McKenna. Craig's been involved in the business field for the last 15 years, I think from an Oracle background, but over the last 10, 15 years has been very proactive in setting up channel partnerships, helping startup businesses, very well connected within the business world and very well respected. We also have, fortunately enough, as a non-executive director, someone called Gary Dickinson. Gary was the managing director here of quite a large corporate, very successful in developing that company and those products globally, and is now working for a leading global dental supplier. We know where we want to be in January, February, early next year. We want to hit the ground running. So there are certain things that have been in place which I'm sure won't change. The branding ideas, the marketing, the message we want to get across. Some of the partnerships that we will develop may change, I'm sure will change. Some of the concepts of how we're going to interact with patients and interact with practices, some of the technical aspects, I'm sure will evolve. But at a high level, we know where we want to be, we know where we're going to go, we certainly know how we want to implement it, we certainly know which practices are coming on board, and then after, we'll take it from there. I'm very confident that within 2 years, we'd certainly see a return on investment. We'd like to look at an exit within the next 3 to 5 years. And again, given the undoubted momentum that this will generate, I can see quite a very good return on investment, certainly in this climate. There are a range of things that investors can look to access, primarily based around dental treatments, starting from laser tooth whitening, where they can go to their own dentist or a VIP Smiles dentist close to them, and certainly within an hour they can have sparkling white teeth. But over and above that, there are other treatments again that they may want to access, depending on the level of investment. VIP Smiles is long overdue. A brand of UK dentistry is long overdue. Myself and my 2 clinical directors have put together the best practices in the country. We're going to give patients access to treatments that they were never thought were available. We're going to make those treatments accessible, and we're going to make sure that they go to a practice that they can trust in. They can trust in those practices because those dentists are recognised amongst their peers as some of the best in the country. There's going to be standardised costs, and there's going to be accessibility. VIP Smiles is going to happen, whether we do it or somebody else does it. We want to make sure that it's done with the best dentists, and we want to make sure it's done now.